Hi, this video is on how to create an RNpad daily assessment at the beginning of your shift. After you log on to my.rnpad.com, you're going to choose your workspace. Make sure Summit Home Health is selected and Nursing Platform is selected, and then select Go to Workspace. Here is where we'll begin our progress notes. This is your dashboard. And at the bottom, there's a blue dot with a plus sign, and we're going to select it. At the top where it says Assessment, you're going to click the drop down and select PDN Progress Notes. Make sure that's your name under Nurse. This is your patient. Under the drop down, you'll select your patient. The due date is today, and we're going to create the task. At the bottom, select it. Before we begin, we're going to add the visit date. In the center there, in the blue bar, you'll see Add Visit Date, and we'll select today's date. Now you're ready to begin your notes. There are 3 forms: their daily assessment, daily narrative, and adult and pediatric seizure charts. If your client doesn't have any seizures, then you can ignore the bottom form. The other 2, as you can see in red, it is required. We're going to start with the daily assessment. You'll select Start Document under Daily Assessment. You'll have your start of shift vital signs. Be sure to enter the value and how you retrieve the value, the pulse rate, and is it regular, irregular, the respiratory rate, the value, and also the description, the SpO2 saturation, and if your client is an adult client, you can enter the blood pressure. Please address the pain level, the respiratory status, if your client has a trach, if they're on a vent. If your client doesn't have any of these, this is where you would select Not Applicable. The mental status of your patient, the ambulatory status of your patient, the safety measures for your patient, bowel movements, if they're continent, incontinent, if there's any colostomy care, and addressing their last BM. Urinary output, again, you'll address if they're continent, incontinent, number of diapers per shift. Their nutrition, G-tube and G-tube status. Please select all that's applicable there. You're going to discuss their skin condition in this section. If it's applicable, you'll discuss their blood glucose levels. And at the end of your shift, you'll address their vital signs once again. Once all these required items are selected and filled out, you'll see at the bottom a sign option, which you will then select, and that's when you'll sign your name and submit the form to our office for review. You can select and go back. So we'll start with a temperature on our client, and we'll say it's a 98.5. And we got a temporal temperature reading from that. You can exit this form by going to the top back arrow, and you'll be brought back to that page with your 3 forms. You'll see at the top here by daily assessment in orange, it says in progress. So when you want to go back and fill out more of those items, you can select Continue Document. And what you've put in so far will have saved. As you can see under temperature, her temperature has been saved. And at this time, you can fill out more or complete this form, and then that's where you will sign and send.